Hi, I'm Brian Finestein. I'm CEO at St. Clare's Health, and welcome to Let's Talk Health. I'm here with Dr. Moazami, one of our urologists at St. Clare's, and we're here to talk about a common men's problem, an enlarged prostate. So Dr. Moazami, can you tell us about that? I've heard enlarged prostate, BPH. Can you sort of give us a little bit of an overview and what the symptoms are?
Sure. So benign prostatic hyperplasia, or BPH, also known as enlarged prostate, is a condition that affects many men. The prostate gland is approximately the size of a walnut, sits underneath the bladder, and it's wrapped around the urethra. As the prostate grows, as a man ages, it can cause constriction of the urethra, resulting in lower urinary tract symptoms such as a weak urine stream, the sensation that one has to constantly find a bathroom or urinate frequently during the day, increased frequency of urination at nighttime, the complete loss of the ability to hold your urine, and in most severe cases, the inability to urinate at all.
Wow. So what are the first steps? When and how do you access a urologist to start this treatment, or at least to look at what are next steps?
So the first step in assessing a patient is to see the degree of severity of the issue. And once we assess how severe the problem is for the patient, we typically start with some behavioral modifications. And these can include avoiding certain bladder irritants such as caffeine and alcohol, nighttime fluid restriction, meaning decreasing your food and fluid intake a few hours prior to bedtime, using the bathroom before getting into bed at night. And in a lot of men, especially those with mild symptoms, these modifications may be enough. However, in many men, you need to combine these behavioral modifications with some sort of medication, either alpha blockers or 5-alpha reductase inhibitors, which are the two classes of medications that we often use.
Now, I think it's commonly known that men are slow to seek help. What are the downsides if you don't?
So some of the downsides are that if left untreated, BPH can progress to some serious issues, and these could include irreversible damage to the bladder or the kidneys. You could develop bladder stones, recurrent urinary tract infections. In some men, they could present with persistent blood in the urine. And in the most severe cases, there's a complete loss of the ability to urinate at all. And this could put a lot of pressure both on the bladder and the kidneys, requiring the patient to be hospitalized.
Ooh, okay. You mentioned a couple of medications that are potential for treatment. Are there side effects for these?
Absolutely. So there are two classes of medications that we often use to treat BPH. The most common are the alpha blockers, and one of the most frequently used alpha blockers is Flomax, also known as tamsulosin. And what these medications do is cause a relaxation in the smooth muscle at the neck of the bladder and within the prostate gland, and this allows the patient to urinate a little bit more easily. The second class of medications are called 5-alpha reductase inhibitors, and two of the most common ones that we use are finasteride and dutasteride, also known as Proscar and Avodart. And the way these medications work are by blocking the conversion of testosterone to DHT, or dihydrotestosterone, and this can result in shrinking of the prostate gland, which can also help alleviate symptoms. And a lot of times these two medications have to be used together. Regarding the side effects, so with alpha blockers, men will often report that they'll be dizzy while on these medications. Some men see a drop in their blood pressure if they go from sitting to standing too quickly. Many men will report problems with ejaculation, such as retrograde ejaculation. And some percentage of men will also report headaches or stuffy nose. With regards to the 5-alpha reductase inhibitors, we often will get complaints that there's a loss of sex drive. Men will experience some both ejaculatory and erectile dysfunction, and in a very small percentage of men, they may even experience breast enlargement or tenderness.
Now, I'm assuming we should contact our urologist if any of those symptoms persist.
Yes, absolutely.
Okay. Now, at St. Clare's, we have this new technology. Maybe this is it, that you can
Yes.
talk about aquablation. So we're trying to bring new technology to the forefront. Can you talk to us about this?
Sure. So aquablation is a robotic guided water dissection of the prostate gland, and it uses a heat-free water jet in order to ablate or dissect the tissue that is causing blockage of the urine flow. Regards to aquablation, it is the only BPH surgical modality out right now that employs both the use of a cystoscope, which is a camera, in addition to a transrectal ultrasound probe, which allows us to obtain real-time images of the prostate. And the benefit of this is that you can create a treatment plan that's precise, consistent, and predictable, and can result in some real positive clinical outcomes for the patient.
Now, after surgery, what's the recovery like for patients?
So, like many BPH procedures, aquablation does require a catheter to be placed in the bladder, and this catheter typically stays for about 1 to 3 days. Now, another thing I didn't mention is that for this procedure, it is done in the hospital and it's done under anesthesia. The procedure takes about an hour or less, and for many of the patients, they do require an overnight hospital stay. So once they're discharged, either with or without a catheter, they may experience some mild burning when they urinate, and this could last for a couple of weeks, and it's easily managed with some mild pain medications.
Okay. Now, the tried and true procedure is the TURP. I'm not going to begin to say what that stands for, but maybe you can and explain what that also entails.
The TURP, TURP, or transurethral resection of the prostate, is the gold standard when it comes to surgical modalities. There was actually a study done called the WATER study that compared aquablation treatment to the TURP, and the results of that study found that while both modalities have very similar and positive clinical outcomes, aquablation was shown to have a superior safety profile, meaning that less patients experience some irreversible side effects such as persistent leakage of urine, erectile dysfunction, and also ejaculatory dysfunction.
How do you decide, in other words, the patient comes in, they have this issue, and they've read or heard about aquablation, I want the latest and the best. So how is that determined? Which way you have to go?
So with many of the surgical modalities that we currently have available, one of the issues is that there are often size cutoffs. For a traditional TURP, if a patient has a very large prostate, it may not be a good option. With aquablation therapy, the benefit compared to all the other modalities is that there is no size cutoff. You could do the procedure on men who have smaller glands that are causing a problem, and men who have very, very large prostates that would typically need a more invasive procedure.
Okay. Let me shift gears a little bit. We've also heard a lot about robotics.
Sure.
Does the robot do the whole procedure? Could you sort of talk to us through that? I know it's off topic to the enlarged prostate, but I think our viewers would like to hear about that.
There is this misconception that once the patient's in the room, the robot's going to come in and we press a button and the robot is going to do the entire operation. But in reality, what we mean by robotic assisted is that the physician uses the robotic assistance in order to perform the procedure. So what we're doing is we're taking an operation that we've been doing for decades and we're implementing technology in order to make it better.
Okay. Appreciate that. I think that's what we're all about. Now, our tagline, by the way, is around the corner, ahead of the curve. So we like to think we provide compassionate care, and as you've outlined, we have the latest in technology. What kind of feedback are you getting from your patients? And number one, on the technology, on the care, and on St. Clare's?
So I believe that the care we provide at St. Clare's Health is exceptional, and that men can be confident that we provide the latest and greatest technologies right here close to home. And this exceptional care that we do provide here is something that I would want for myself and for members of my own family.
Okay. Thank you, Dr. Moazami. And to our viewers, again, and men in particular, enlarged prostate is something that you're hearing more about, and I think men need to sort of take a step back and say, I've got some symptoms and I've got to pursue them. As Dr. Moazami outlined, the downside is significant, so the sooner you can take care of the issues that you have, the more apt you are to return to a normal life. So thank you again, viewers, for watching another episode of Let's Talk Health. You can get further information on events through YouTube and on Facebook, and you can also follow us on stclairs.com.